Good evening, my name is Liazia Sweden and I'll be talking about how different people have experienced quarantine. The world is currently experiencing a viral pandemic, the coronavirus, also known as COVID-19. A pandemic is a disease spreading over a whole country or the world. Now, the coronavirus is a pandemic due to its rapid increase in the number of cases outside of China, where it originated. Over the first 2 weeks of its reveal, it has affected a growing number of countries. The disease originated from a Wuhan seafood market, where wild animals including meermits, birds, rabbits, and bats and snakes were traded illegally. Coronaviruses are a large group of viruses that are known to infect both humans and animals. In humans, the virus causes respiratory illnesses that range from a common cold to much more serious infections. Although symptoms of coronaviruses are often mild, the most common symptoms being a fever and dry cough, in some cases they lead to more serious respiratory tract illnesses, including pneumonia and bronchitis. These can be particularly dangerous in older patients or people who have existing health conditions, which appear to be the case with COVID-19. So how far is this virus spreading? China felt the initial consequences of the COVID-19 epidemic in mid-February. The country experienced more than 5,000 cases in a single day. There are now confirmed cases in at least 150 countries and territories. Outside of China, the US has seen the highest number of cases, reaching more than 800,000 cases. How are countries handling this situation though? On the bright side, a lot of people are practicing social distancing.
So my name is Camilla and I'm in Italy right now and I'm currently in lockdown, quarantine.
So, hello, I'm Edward. I live in Belgium. I practice social distancing.
I'm Farah. I'm from Egypt, Alexandria. I've been quarantined for a month now.
Mira Abdelaziz. I live in North Carolina in quarantine.
Some countries like Italy are on lockdown, meaning they can't leave the house unless it is absolutely necessary. What's it like in Italy?
Well, everybody is mostly at home. The places that have been hit by the coronavirus are usually in northern of Italy. I'm currently in the south, but people are still going outside and not respecting distance and stuff. But here in countries, small countries, everybody's actually at home, and there are only a certain amount of people that are allowed in supermarkets and stuff. So they told us to take precautions and to be careful whenever we step outside and take care of our elders and maybe stay away from them to not if we have if we ever get the COVID-19.
Some laws are introduced in highly concentrated regions. It goes as far as if you leave the house without a reason, you will be fined or imprisoned.
And there's a lot of things that happen because of the quarantine. There's a much more police brutality happening in France and Belgium, because the police has to they got the instruction of controlling.
Many countries have now made it illegal to step outside of the house without gloves and masks. And if you are feeling ill, you must quarantine yourself for at least 2 weeks or you will be fined. Quarantine is important because it limits the spread of the virus. If one did contract the virus, they could be able to maintain the spread of it. As for school, thank God for technology evolving throughout the years, because now we can do almost everything online, even attend school.
But thanks to the lovely teachers, we have a lot of assignments, so I don't get to be bored.
People are also taking their own precautions in order to protect themselves from the virus. What type of precautions are your family taking?
My family, whenever they go outside, they wear the masks, they wear gloves, they don't touch anything, they don't touch themselves right afterwards. Whenever they come back home, they tell us all to go upstairs while they unload the grocery, spray the outside bag with Lysol and then spray themselves with Lysol, and then they take a shower, put their clothes in the laundry just in case anything could have gone on them.
We're taking precautions and everything that the government is telling us to do. I'm actually not going outside at all. My parents are for buying groceries when they need, but we're usually always taking the most food and stuff that we can.
At home, every time I get back from the store, I wash my hands carefully.
Face masks, hand gels, and alcohol.
But to what extent has the coronavirus outbreak psychologically impacted people? As new measures are introduced, especially quarantine and its effect on many people's usual activity, routines, and livelihood, levels of loneliness, depression, harmful alcohol and drug abuse, and self-harm or suicidal behaviors are also expected to rise. In populations already heavily affected, issues for people with developing or existing mental health conditions are also now a major concern, along with mental health and well-being of healthcare workers. It's harder to adapt to such changes in a small amount of time. This whole situation came out of nowhere for many people. People are starting to realize that their whole lives for the next few months or even years are going to change. They begin to lose their usual routine. Loss of usual routine and reduced social and physical contact with others were frequently shown to cause boredom, frustration, and a sense of isolation from the rest of the world. So, how were the first few weeks of quarantine like for you?
Pretty boring because I came to Belgium in the perspective of getting to see my friends and getting to play basketball with my previous team.
The first few weeks for in quarantine, I think it was like just the same as everybody else. It was kind of a shock when it first happened because it was like we'd never really expected that to happen. But then it just felt like, oh, like, is this gonna end soon? We just didn't know. And now it's just like, okay, like we're not even waiting for it to end.
A study from Canada examined the quarantine of 10 days during the SARS outbreak of 2003. They found a high prevalence of psychological distress symptoms. 29% of participants reported symptoms of post-traumatic stress, and 31% of respondents reported symptoms of depression. Participants in the studies described a sense of isolation and were particularly affected by the lack of social and physical contact with family members. The outbreak of COVID-19 may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Many become anxious to leave the house in fear of contracting the disease. This can lead to many people becoming overwhelmed by a small interaction and fear of leaving the house.
Right now, like, you know, like when you get a cold, you sort of feel a sore throat. That's what I'm starting to get right now. And I know it's probably nothing drastic, but again, like it's still like with everything that's happening and with the fact that our country isn't taking the proper measures, not even taking decent measures to help contain the virus, it just feels like, oh, what if one day I do wake up and somehow I'm pretty sure I don't. I just don't want to have I don't want to have the possibility of having it just because I live with a family of I live in a family of 6 and I have a little baby sister and I have 2 parents and I don't want to be able to be a threat to those people.
Many people start to think of the worst case scenario. The world has gone through something like this before. The Spanish influenza of 1920s is an example of an outbreak. However, it didn't spread as quickly as the coronavirus outbreak. The government was not prepared. The coronavirus turned out to be a shock for almost everyone. Personally, living in the UAE, I didn't feel ready for such drastic change. I went from hanging out with all my friends in ice rinks and malls to staying at home binging How I Met Your Mother. Did you feel like you were prepared?
My mom was prepared. Like before we were quarantined or anything happened, like when schools were shut down, my mom kept buying medical supplies. So personally, my family was prepared. But for me, mentally, I wasn't because I used to go out a lot because I had like SAT classes and stuff. So I went from going out twice a day to like not going out at all. So I was kind of scared.
I don't think any of the countries were prepared because China had to construct a hospital and now China is sending masks to Europe and America.
Not really. They just told us without notice, and many of us actually left our books at school and they were going to throw them away, but then they figured out that maybe they probably shouldn't have done that. So yeah.
I sort of got like eased into it just because when my quarantine happened, it was way after it started for you. So I was like, why is everybody else starting and we're not? My mom was about to get to the point where she was just going to pull us out of school if they weren't going to do anything. But then one thing happened, which was E. coli spreading into our water system. And and then we got quarantined for that, and then we got quarantined for coronavirus right after that.
Some people have gone as far as to start protesting against quarantine. Okay, so what are your thoughts about the protests?
Dumb. I think it's dangerous. I think everybody who's part of the protest should be charged with genocide, homicide, whatever it is. They should get, at the very least, they should get like a life sentence in prison. I have no remorse for those people because they're all just in it for themselves. They don't really care about anybody else. And the government doesn't see it that way. Like, I could go off forever.
There are nearly 45,000 confirmed deaths in the US related to coronaviruses and more than 800,000 confirmed cases total. In desperate efforts to slow the spread of the virus, much of the country is under stay-at-home orders that have been deemed necessary by healthcare experts. However, people are not happy about these changes. Thus, a protest began.
I'm sure you've heard of what's happening in America right now. Basically, there's a bunch of protests for people who are anti-lockdown. They go out into the streets, sometimes without masks, a lot of times without masks, and they just protest against it. When it started, I think it started in Colorado. There are 2 healthcare workers that were trying to get to their workplace, and a bunch of people just stopped them from entering just because they were completely anti-lockdown.
Protesters blocked traffic, held up Confederate flags, promoted picnics with people wearing no face masks, and encouraged protesters to push up against each other in order to express their freedom. These protesters believe that the measures these health socialists are taking are not necessary. They believe that their rights and freedoms as Americans is being deprived from them. Therefore, they are protesting for their rights to leave the house whenever they want to.
Everybody else, they're very self-serving. They feel like in their house they're trapped or something, which I get it. Like, if you don't see the outside world in months, it could start to get to you, but at the same time, it is affecting other people, and they're not thinking of other people. They're only thinking of themselves. First Amendment right may be freedom of speech or freedom to your own just things or whatever, but those freedoms stop when it infringes upon somebody else's freedom. And nobody seems to understand that. All they want to pay attention to is that this is their freedom, but it's not. It's still a crime, and they should be locked up for it. They also bring their children into the protests, which is like, if you want to go out there and endanger the rest of the world, okay, but your child should have nothing to do with this. That your child will be the first one infected.
Some Americans believe that corona isn't even a real virus. When they don't believe that it's a real virus, they are ignoring the consequences of it. They are ignoring the other countries that have suffered from it. They are not willing to take any proper measures to contain the outbreak.
Part of the protest, they genuinely don't think coronavirus is real, which I still think is, again, very self-centered, because they're not looking at the rest of the world. What they're looking at is America. A lot of the times people will be like, oh, only quarantine the people who are sick if there really is a disease. But like, they don't understand that you don't know who in this country is sick, because all those people don't have access to, not everybody in America has access to go in and to check to see if they are sick or not. And again, that's self-centered.
Finally, who are the ones that are affected the most because of this pandemic? Healthcare workers. Healthcare workers are working 24/7 to make sure that the coronavirus is under control and trying their hardest to take care of everyone that enters through hospital doors. They are in constant fear of being close to death. They are putting their lives on the line to promise safety for their country. And after the pandemic is over, the constant fear of the virus's return will not vanish, since they were exposed to high risk of contracting the virus. A study of hospital staff who might have come in contact with SARS, a disease that spread in 2003, found that immediately after the quarantine period of 10 days ended, healthcare workers showed symptoms of acute stress disorder. In the same study, quarantine staff were significantly more likely to report exhaustion, detachment from others, anxiety when dealing with patients, insomnia, and poor concentration. These healthcare workers are facing the real problem, and they are trying to fight it off. They are trying to help patients. It's harder for them than it is for anyone else. So what can we do in order to support them? What can we do in order to help them? Stay at home.
I'm Yazia's aunt. I work in a hospital as an admin. Okay, I think we're getting a little bit used to it, so it's not as stressful as before. But now we're stressed that we might have corona and we might be the reason why any one of our family member might get it. So that's the stressful part about it. But we're not stressed about the disease itself or the virus itself. Generally speaking, people get stressed out because of less beds in the hospitals, because beds are getting full quickly. And if this continues to spread as fast as it's spreading right now, it might be quite stressful. I think people should just keep to themselves. Even with your family, you shouldn't be too close to people who go out all the time. And you have to keep space. Yes, yeah, I'm talking to you. You should stay away from me. And yeah, your hygiene, general hygiene. You should clean your hands, and you should stay at home. Of course, we all have to go out sometime for grocery shopping or for something urgent, for hospital visits if urgent. But we have to keep it to a minimum. And yeah, I think that's what I think. Yeah.
Okay, thank you. Welcome. I'm gonna disinfect my phone.